Hi, I'm Dr. Rose Petrillo, the Primal Professor, and today we're talking about a very important subject. Who shouldn't be doing keto or carnivore? Everybody talks about the benefits of keto and carnivore, and yes, they can be very powerful for weight loss, reversing insulin resistance, and regaining your health. But here's the truth. Not everyone should do these diets, or at least not without medical supervision. If you're on Ozempic, if you have kidney disease, if you have had bariatric surgery, or you're going through a cancer treatment, today's video is for you. So we're going to start with medications because that's the biggest category. So if you're on insulin or diabetes drugs like sulfonylureas, keto can drop your blood sugar fast. And that's great when it's supervised, but dangerous if you're flying solo. It can lead to severe hypoglycemia, which is when your blood sugar drops too low. If you're on blood pressure medications, keto often lowers blood pressure quickly. Carnivore maybe even faster. That means your prescription dose might suddenly become too strong and you could end up getting dizzy or faint, and we call that orthostatic hypotension. You'll notice it when you get up really quickly. And if you're on blood thinners like warfarin, or another name for that is Coumadin, keto and carnivore can change your vitamin K intake. The rule isn't to avoid vitamin K, it's just to keep it consistent. And if your diet suddenly changes, your INR can get thrown off. The takeaway, if your meds move blood sugar, blood pressure, or clotting, you don't do ketovore or carnivore without your physician on board. Now let's talk kidney disease because this one depends on the stage. If you have early to moderate chronic kidney disease, stages 1 through 3, keto may actually help protect the kidneys by improving blood sugar, insulin levels, weight, and blood pressure. But your protein targets need to be customized and your labs monitored. Things for like creatine, EGFR, and potassium. And if you're stage 4 chronic kidney disease, pre-dialysis, this gets even riskier. A very high protein diet like carnivore could accelerate decline. If keto is attempted, it should be lower to moderate protein, higher fat, and done under nephrology and dietitian supervision, one that is very familiar with the ketogenic diet. And if you're in end-stage renal disease or on dialysis, keto and carnivore are not appropriate unless the nephrologist specifically tailors it. Dialysis patients have very strict protein, potassium, and phosphorus needs that can't be met safely in a one-size-fits-all plan. Next up, bariatric patients. For some of you who might be new to the channel, I am a post-bariatric patient. I had a lap band done approximately 15 years ago, and it served me well. I lost 60 pounds with the lap band. Kept diabetes type 2 out of my life, but I still had insulin resistance, and that's when I found the ketogenic diet, and I lost an additional 30 pounds. And then about, I guess it's 2 years now, 2 years ago, my lap band slipped and I had it removed, and I put on 5 or 6 pounds that I couldn't move. So I had then upped it a level and went from keto to carnivore, and I lost 12 pounds, and I'm 5 pounds away from my goal weight from when I got married. So it is a very useful tool. And I was keto for 5 years when I still had my lap band, and I was very successful. I didn't have any nutritional gaps, and it can be done. But usually after bariatric surgery, your stomach is tiny and your absorption is reduced. Whether it's gastric bypass, the lap band, or the sleeve. You absolutely must prioritize protein and lifelong micronutrient supplements like iron, B12, or calcium, and vitamin D. The only one I took was vitamin D, and that's because my office and my work environment had no windows, and I spent a lot of time there. Otherwise, on keto, I was able to get all my micronutrients, but I would think somebody with gastric bypass surgery has a much more difficult time. If you go strict carnivore or poorly planned keto, and that's the key word, poorly planned, and don't supplement properly, you can end up with muscle loss, fatigue, and nutrient deficiencies. Low-carb eating can help bariatric patients maintain their weight loss, and it absolutely did that for me. And it also extended it the additional 30 pounds that I needed to lose. But it must be done with the bariatric team to keep protein and micronutrients in check. I did not do it with my bariatric team. I am a healthcare professional, and I tracked my food intake and my protein, fats, and carbs every single day. So I was pretty diligent about it. So I knew I was getting the protein that I needed. However, with some of the other types of bariatric surgery, you may need a little more guidance on the micronutrients as well. Now, what about cancer? There's growing interest in ketogenic diets as metabolic therapy. It's pretty amazing. Some studies show promise, especially for brain cancers, but the evidence is mixed. Here's the problem. Cancer patients often struggle with malnutrition, muscle loss, known as cachexia. A strict keto and carnivore diet can make this worse if calories and protein aren't carefully protected. And that's because the keto and carnivore diets really reduce cravings and appetite. If someone wants to try keto during cancer treatment, it must be coordinated with the oncology team and again, a dietitian who is versed in the ketogenic diet, who understands ketogenic therapy. It's not a DIY cancer cure. Now here's a controversial one. People on Ozempic, Wegovy, Mounjaro, or other GLP-1 medications. So these drugs already blunt your appetite and slow digestion, and combine that with a keto and carnivore diet, which naturally reduces hunger, you've got a recipe for undereating. This can lead to muscle loss, electrolyte imbalances, and nutrient deficiencies. And we know from studies that people on GLP-1s lose significant amounts of lean mass unless they deliberately focus on protein and resistance training. So if you combine a GLP-1 with keto, you must set a protein floor, which is the minimum amount of protein. That gives you the nutrients and the building blocks. Then you need to train. You need to do resistance exercise. That's the stimulus that tells the body to maintain and grow muscle. And you need to track electrolytes and do it with your doctor. Otherwise, you're doubling up on the risk. Now, my brother and I both started, he is 13 years older than me. We both started keto at the same time. He is a recovering addict. So he lost weight on keto, but then that addictive behavior, which is always hard, he still gained weight on keto foods. You can gain weight on keto foods. He had made the decision to go on a GLP-1, which really kind of quieted that addiction part of his brain, and he did beautifully. And he still remained keto while taking the GLP-1. And his weight loss journey was almost effortless and very successful. And it helped him with his COPD. He said, I have abs again. You can see them, muscles in my arms. He feels great, absolutely great. There are a few other conditions to mention. Gout. In the early stages of keto, uric acid can rise and trigger flare-ups. It competes for release in the kidneys with ketones. But hang in there. Over time, it may improve, but the first few months, it can be very rocky. Pancreatitis. Now, I have kind of secondhand knowledge. My brother, who was a recovering addict, suffered from severe pancreatitis. Ranks up there with kidney stone pain and childbirth. He almost died from it. He was hospitalized for 6 months. He couldn't take even water by mouth. His pancreas had cysts on it. They were sure he was going to end up as an insulin-dependent diabetic in his 40s. He went on to have the Whipple procedure, which is a very intense, tedious reconstruction of your digestive tract, and it actually saved his life. He has been in recovery now for almost 30 years, and he's the one who's on the GLP-1. He became type 2 diabetic, I would say, in his late 60s, and also does keto. We started it together. So he does very well. He did not need the amylase and lipase enzymes. He was able to digest. In the beginning, he had to build up with protein and fat slowly, but he knew if his pancreas, he called it barking, he would back off or slow down a little bit. But now on the GLP-1, his pancreas feels better than ever before while doing keto. So I just wanted to share that with you. Everybody's different, but he did very well with that. So with pancreatitis, especially if it's recent, a high-fat diet can be dangerous because you end up having trouble producing the enzymes to help break down and the protein and the fats. So the guidelines are usually to start off on a low-fat diet, low-fat foods until you've been cleared by your GI team. As I said, my brother was hospitalized for 6 months and went from 220 pounds down to, I think, something like 135. His waist was below 29 or 27, and he lives to tell about it. God bless him. But yeah, so that's a very serious disease. So you want to be very, very careful with it. So pregnancy and breastfeeding deserve a very careful note. Official guidelines usually recommend about at least 175 grams of carbs per day during pregnancy, largely to support fetal development. I mean, you're growing a placenta, your body is it is amazing the changes your body goes through. So most providers don't recommend a strict keto diet during that time frame. That said, there are women like Nisha Berry and others who have successfully followed a ketovore approach during pregnancy and breastfeeding. The key here, though, is that they were already well adapted to low carb eating before conceiving. That probably led to the conceiving, actually. And they paid close attention to their electrolytes and their nutrient density. Where I draw the line is this. If keto or carnivore was your diet plan before and during pregnancy, it can often be continued with medical guidance while breastfeeding. But I would not recommend starting keto or carnivore for the very first time during pregnancy or nursing. That's when supervision would matter the most. And finally, one last group, people who have eating disorders. If your struggle has been sugar or food addiction, keto and carnivore, honestly, from what I hear, it feels like freedom. All that food noise goes away. By removing the trigger foods, cravings often settle dramatically. But for those who have a binge eating disorder, anorexia or bulimia, these diets can be risky. A restrictive plan can reinforce old cycles or make things worse. For binge eating, the gold standard treatment is CBT, cognitive behavioral therapy. That's not a certification, it's a form of talk therapy that helps people change unhelpful thoughts and behavioral patterns. There's even a specialized version called CBTE, designed specifically for eating disorders. So my boundary is this. I work with people who are struggling with sugar addiction, but anorexia, bulimia, and diagnosed binge eating disorders require a professional team. Please don't try to tackle those with a diet alone. So keto and carnivore are powerful tools. They can be life-changing, but not for everyone. And if you're on a certain medication and you have kidney, gallbladder, or pancreatic disease, if you're pregnant or breastfeeding, if you're post-bariatric, in cancer care, or on Ozempic, or dealing with the eating disorder, you need to seek medical supervision, and definitely let your doctor know that you like to try this. And if you're not in those categories, keto and carnivore are powerful tools for healing. So drop your questions below. Tell me your situation. I'll point you to safer next steps. And if you want a structured way to start keto, my ebook, Keto Made Simple, and my coaching programs are linked in the description. I'll see you in the next video. I hope this was helpful.